Okay, we can edit this out. So, and Seth, is your last name pronounced Gyamphy?
It's called Gyamfi.
Gyamfi. Okay, Gyamfi.
Yeah,
I'm glad that I
yeah.
asked. Gyamfi. Seth, Barbara always makes fun of me for my American accent, so.
Okay, that's okay.
All right, about 1 minute.
Is the LinkedIn live on, or it will go live when we started?
It'll go live when y'all are ready in just a few seconds.
Okay,
but yeah.
all right. Okay.
If y'all are ready, I can press the go live.
Yeah, I am ready.
Yeah,
all right. We'll go live.
Hi, everyone. Good morning, good afternoon, good evening. From wherever you are in the world, thank you so much for joining us today. I'm Grace Peters, and I am tuning in here from our Smile Train office here in New York. And at Smile Train, I develop and expand our comprehensive cleft care programs, which includes our psychosocial programs and is why we are here today. I am personally really excited that we are here now for this LinkedIn Live conversation, talking about psychosocial care and counseling for patients and families impacted by cleft, because I was born with a cleft lip and palate here in the US, and I know firsthand the importance of this type of care and the long-term impact that it has on patients and families, quality of life, and ability to thrive. Before I introduce Seth, I just wanted to quickly touch on the importance of psychosocial care for Smile Train and share a little bit about why we are here. This month is National Counseling Awareness Month, and it is so important that we recognize the role of counseling within cleft and comprehensive cleft care and mental health conversations, and the importance of debunking stigma related to mental health. At Smile Train, we know that psychosocial counseling is really important and just as important as other cleft treatment. And research indicates that children with cleft are at a slightly higher risk of having psychosocial challenges. Children who are mocked and feel isolated will often have poor self-esteem and negative self-image. And even after having cleft surgery at an early age, it's not enough to make these issues go away. Ongoing assessments from social workers like Seth or mental health professionals are always recommended to help cleft affected people cope with their challenges. So without further ado, I'm going to hand it over to Seth, a Smile Train partner who has an incredible background of over 10 years of experience working as a social worker for cleft affected patients and families, to share a little bit more about himself, and then we will get started with the Q&A session. Seth, over to you.
Hello, everybody. Good afternoon from Kumasi, Ghana, and good evening, good morning to everybody, wherever you are listening to this live discussion from. As Grace mentioned, my name is Seth Gyamfi. I'm currently working with the Konfanochi Teaching Hospital. Currently, I'm a principal social worker, and then I'm also the social worker attached to the multidisciplinary cleft clinic of the hospital. I started working at this hospital in 2010, and in 2011, that's a year afterwards, there was opportunity to join the cleft team. I actually volunteered when my boss told us that the clinic is in need of a social worker and he would like one of us to volunteer to join. And I volunteered to be part of the cleft team at the hospital. And I can say that it has been an amazing experience being a social worker at the cleft clinic at Confanochi Teaching Hospital. When I joined the team, I was able to initiate, together with the team, the home visit program, where we visited patients that we had treated in their homes, in their communities, to assess how they were doing after receiving cleft surgeries. And we realized that this home visit was impactful. We realized that it helped to create awareness about cleft, and it also helped to reduce the stigma and abuse that some of our patients were facing in their homes, in their families, and in their communities. As a social worker at this hospital, I don't only deal with patients with cleft. Currently, I work at the pediatric department where I see other cases in addition to children with cleft. So I provide support and social care services for children with cancer, children with HIV and other chronic conditions. I also provide care and support for abandoned babies. I also provide care and support for children who have been abandoned or neglected by their families, or children who have been sexually or physically abused. I can say that my work in cleft has given me a lot of opportunities and avenues to bring help and also to improve upon my work as a social worker. Through the work that I was doing at the cleft clinic, it also created the need for social work services to be taken to other areas or other clinical areas where social work was not available. So currently, when you come to the Confanochi Clinic, we have social workers attached to the pediatric oncology team. We also have social workers attached to the head and neck clinic, which is a specialty clinic which takes care of adults with cancers and other deformities affecting the head and neck region, and other areas which have seen the importance of including social care in medical care. And this was because of the impact that the work that I started at the cleft clinic was making, and that opened the door for other clinics to also involve social workers in their care. I've also been able, by the work that I've done in cleft, I've got an opportunity to secure a scholarship, a Chevening scholarship, which enabled me to study for a master's in health policy planning and financing at the London School of Hygiene and Tropical Medicine, and also the London School of Economics and Political Science. In 2019, I was privileged to be given an award as the best senior support staff at the child health department at the Confanochi Teaching Hospital. So I must say it has been a real privilege providing support and care for children with cleft. And I want to thank, first of all, my team at the Confanochi Teaching Hospital for the support and the encouragement that they give me to always be the best. And I thank Grace and your team and Smile Train for this opportunity to talk more about the work that I'm doing for children with cleft at the Confanochi Teaching Hospital. Thank you very much.
Wow, thank you so much, Seth. Your experience is unmatched and so impressive. Thank you so much for being here. So now we will get into our Q&A session. So Seth, we have a few questions for you related to psychosocial care and counseling within cleft. So first question, why is psychosocial counseling important for children and families impacted by cleft?
I would say that it is a key aspect of the service that children with cleft and their families require. And it's not only just an important aspect required by children with cleft, but any person who has any challenge affecting his health, whether it's environmental, whether it's emotional, whether it's psychological, requires psychosocial counseling or psychosocial care to be able to improve the health and the well-being of that person. Specifically, when we talk about psychosocial counseling in cleft, it is important because cleft is associated with a lot of emotional stress and anxiety. And so it is important that as part of the care provided to children and their families, psychosocial counseling is also one of the care services that is provided to them. From my experience, a lot of the parents that I see at our center have little or no knowledge about what cleft is. And so when they come to the hospital, they are anxious, they are stressed up, they are in a lot of emotional trauma. And therefore, it's important that through the psychosocial counseling, information is given to them to deepen their understanding of what the condition is, to help them understand the treatment procedures and the treatment plans which the condition entails. Psychosocial counseling helps to satisfy the informational need that parents and children require as a result of the lack of information that they have on cleft. And secondly, through psychosocial counseling, it helps to build trust and rapport with the families and the children who are impacted by cleft. Treatment of cleft sometimes is long-term, and to be able to get the support of parents and children to continue with this long-term treatment, you should be able to build trust. They should be able to have confidence in the healthcare providers or in the healthcare team. And you can be able to build confidence and trust when, through the psychosocial counseling, we are able to involve them in the decisions which concern them. When we are able to help them to participate in decisions which concern them, it gives them a sense of ownership. And by giving them a sense of ownership, we are building trust in them. We are also helping to build trust in us, so that together with them, we can form a partnership to be able to provide the appropriate treatment required for the child or required by the family, which is distressed because of having a child with cleft. And so it is important that we provide them with the psychosocial counseling. Lastly, on this question, why psychosocial counseling is important, I would say that psychosocial counseling helps to build resilience in the family or in the child with cleft. Cleft comes with stigma or associated with some form of discrimination in some communities. And to be able to build the resilience of the patient or the family or the child, psychosocial counseling is one of the ways that we could do it. Through psychosocial counseling, we are able to provide the family, the child, with information on resources where they could get support from, to be able to deal with the abuse, the stigma, and other forms of discrimination that they face. And once they are able to get the support that they need to be able to deal with the various forms of abuse and stigma, that helps them to be resilient to the challenges that they face, so that they can be able to continue the treatment to have a full and productive life. Thank you very much.
Wow, that was great. Something that really resonated with me that you said was reassuring the families, because the families, once they're reassured of the process and of the treatment that needs to take place and of their baby with cleft, then they can reassure their baby when their baby grows up and becomes older and is starting to question, you know, why they might look a little bit different. Having the parents be the ones to confidently say that everything, you know, will be okay, and reassuring the patient, I think that is so important, and first starts with making sure that the families and caregivers are confident. So the next question is, what challenge, and you did touch on some of the challenges that patients with cleft and families have related to psychosocial care, but what other challenges, or what can you briefly describe that you encounter as challenges that patients and families face?
Okay, in our, especially in sub-Saharan Africa, one of the challenges that we face in terms of getting psychosocial care for children with cleft and their families is access to care. In Ghana, for instance, there are only 2 centers which provide comprehensive cleft care. Our center in Kumasi, the second largest city in Ghana, and the other one is in Accra, the capital of Ghana. For our center, the clinic meets every Wednesday to provide services to children with cleft and their family. And the information that I have is that the clinic in Accra meets once every month. And so it means that access is a challenge in terms of available hospitals to provide the care for children who need psychosocial care. Another issue related to that of access is the availability of personnel who are equipped, who have the requisite knowledge and skills to be able to provide appropriate psychosocial care to children with cleft and their families. Not all centers have social workers or psychologists who will be able to provide the appropriate psychosocial care and counseling services for patients or children or families who will be in need of such services. So human resource and also facilities where care can be received is one of the challenge. The second challenge, which I touched on earlier on, is that of stigma. And because of the stigma associated with cleft, because of the abuse and discrimination and other forms of maltreatment that children with cleft and families with cleft face, it deters them from even presenting their children or their families going to the cleft centers or the hospitals to get care, because they don't want the public to know, they don't want their community members to know that they have a child with cleft, because in some communities, cleft is seen, unfortunately, as a taboo. And so if a family has a child with cleft, there's some form of discrimination, there's some form of abuse against that family. So in order not to be exposed to the stigma, they will rather not expose the child or get the people to be aware that they have a child with cleft, so that they will face stigma. And then another challenge, which will be my final point on this question, is the financial burden which a lot of parents or families face in terms of getting access to psychosocial care. In cases where psychosocial care is not covered by health insurance, or where they don't have, or the families or the children don't have health insurance, and they will have to pay out of pocket for these services, and the families don't have, it means that the financial burden will be a barrier to the families or the children getting the psychosocial care or the support which is required. And I'm happy that Smile Train has support to provide some assistance for families who might have difficulties financially and will not be able to provide, will not be able to afford the cost of psychosocial care. So these challenges, the human resources, the unavailability of facilities, the stigma and financial burdens are some of the challenges that, in my experience, are very serious challenges which impede psychosocial care. Thank you very much.
Thank you so much, Seth. And moving to the next question, what do you work, how do you work with children with clefts and their families to help them understand and cope with some of these challenges that they face?
Okay, thank you very much. First of all, before I'm able to determine an appropriate intervention, it is important that I make an assessment of the family, of the child, the challenges that they have, the needs that they have, the risk that they are facing, so that I'll be able to provide the appropriate intervention. When we come to our center, one of the ways that we work with children and the families to cope with the challenges is to give them education. So when you come to the clinic, every time that the clinic is in session, you have the nurses educating the parents, the children on some of the issues which pertain to cleft. When I also get a chance to speak with the families or the patients on a one-on-one basis, I also educate them. We also have some educational materials that we also give out to them so that even as they go back to their communities, they will take those educational materials, and that will also help educate the members of their communities about what cleft is in order to help reduce the instances of abuse and stigma. Other ways that we work with our families and our children is through our support groups. Currently at our center, we have the parent support group, and this is a group which is made up of the parents who bring their children to our center. And as part of the activities, they meet quarterly to discuss issues affecting their children, to discuss issues affecting their families, issues pertaining on stigma, issues pertaining to some of the feeding challenges or the nutritional challenges that they are facing. And they share experiences as to how they've been able to overcome some of the challenges, so that especially the new mothers who have come or joined the group will be able to get some information that will be able to help them cope or deal with the challenges associated with caring for a child with cleft. Another way that we also work with our children and their families is through our home visits. It's one of the initiatives which I brought on board when I joined, and it has helped us to be able to conduct ecological assessments of the environment that our patients, the children, are coming from, to know the risks that they are in, to know the challenges that they are facing, so that we can be able to provide safeguarding measures for the children, even in their communities, to be able to protect them against some of the challenges and risks that they face because of them having cleft. So these are some of the ways that we work with the children and their families to help them cope with the challenges that they face.
I love that you mentioned the support groups, because that is definitely, inside of Ghana, but also around across Africa and around the world. Support groups for mothers and caregivers is such a great way for them to come together and have a conversation about the challenges or successes that they have experienced. What resources do you provide to families to help them manage the medical and emotional aspect of having a child with cleft?
Okay, first of all, I think I mentioned this earlier, that our center is one of only 2 centers in Ghana which provides comprehensive cleft care, which provides hospital-based team care for children with cleft and their families. So when you come to our center, we have the team made up of surgeons, pediatricians, orthodontists, nurses, nutritionists, speech therapists, social workers, who all come together to provide comprehensive team care for children. And so for children who have clefts in Ghana, we are readily available all year round to provide them with care, so that they don't have to wait for a team to come from somewhere to provide. We are always available every year. And as I mentioned earlier on, our clinic meets every Wednesday. Yesterday we met. And so we are always available, made up of different specialties to provide care. Aside the availability of these specialized human resources, we also have financial support and resources provided by Smart Train and its local partner, the Ghana Cleft Foundation, in helping to provide financial support to train the human personnel, the staff, the team members, so that they'll be able to have the required skills to provide quality care for children and their family, and also providing some of the logistic needs which are required to provide better and quality care for children with cleft and their families. Also, we also have educational materials that are used in educating families and children on clefts. And these educational materials are very useful resources that we provide for our patients. And also, we also have access to a vehicle which helps us to undertake our home visits. And this is a very useful resources. The only challenge is that the vehicle is not exclusively for our clinic. And so we share it with other departments. So sometimes we need to give ample time when we have to use it before we can get. So, but I'm sure there are plans in the future. Hopefully this year we can get our own exclusive vehicle that we can use to undertake home visits. And even one of the things that we are even planning to do as part of the things that we are going to use to support our families is to undertake school visits so that we can be able to also assess how our children are doing in school, what challenges that they are facing in school, so that together with the teachers and the school authorities, we can be able to also help them overcome some of the challenges that they face as children with clefts in educational institutions. And then lastly, other resource that we have is that we have appropriate wards and theaters where surgeries are performed, where children are kept before and after surgery to receive care. Currently, Smile Train is putting up a cleft learning center at our facility. And hopefully this center, when completed, would help to even improve the resource that we have. We improve the care that we have, because it will be more child-friendly and to be appropriate for children with cleft. And so I'm sure that this center, when done, will make our center truly a center of excellence when it comes to cleft care in Africa and in the world at large. Thank you.
Thank you, Seth. You guys are doing so much. It's so incredible to hear all the work that you're doing. And for those listening, you know, this team care that Seth was mentioning is not often the case, and so that is so important to the psychosocial aspect of support for patients, because that means that your whole team is speaking the same language, and they can refer patients to you, or you can refer patients to them depending on what the patient or family needs. So our last question before we answer a few questions that have been proposed by the audience is, what are some success stories that you can share about children with cleft and their families that you have worked with?
There are quite a number of success stories that I can share. I think I will only share two of them, which are very dear to my heart. The first one is when we began our home visits, I think somewhere around 2012, we went on a home visit to one of the communities, which is about 90 kilometers from our center. We had gone to see one of our patients, and when we got there, he was well. His parents told us that, oh, we have an 8-year-old boy in this community with an unrepaired cleft lip. So we asked for directions to the residence of this boy. We went there. We couldn't meet the mother. We got to know that the father has been out of the picture since the child was born because of the cleft deformity. So it was just the mother and the grandmother who were taking care of the child. The mother had gone to the farm as at the time we went there. So we left a message that they should bring the child to the clinic the next week so that we would provide the necessary support, and if possible, do surgery for him if all things are okay. We waited the week, they didn't come. So I discussed with the team that it's important that we go to this community and bring this child to the clinic to provide him with the necessary support that we can. Thankfully, my team agreed, and so they sent me together with another team member to go and get this boy. We went with our vehicle, which was branded in cleft, pray, and post pictures. We brought the boy. This time when we went, the mother was there. She had already been informed about our previous visits. So she agreed to come with us. It was on Wednesday when we went there. So when we returned back, the clinic was in session. So the child was booked for clinic the following day. And it was amazing, the transformation which he had on his face. And I remember when we took him back to the community, the whole community trooped to our bus to see the transformed, he was called Kwejo, who looked differently now. Before then, Kwejo was not going to school. He was being teased by his colleagues. But after the surgery, Kwejo started going back to school. It's been a while since I followed up, but I'm sure life is better for him now. And this is all due to the support that we received from Smart Train and also from the Ghana Cleft Foundation to provide some of this support for these patients who benefited from free cleft surgery when we found him with an unrepaired cleft on one of our home visits. The second one was a community sensitization program that we had for a community. This became needed because a child from that community who was at the point of being killed, because in the community, cleft was seen as a taboo. But thanks to the intervention of a community worker who saved this child and brought the child to our clinic for us to perform the surgery for him, this child was saved. So after the surgery, we thought it wise to go into the community, see the elders, the chiefs of the community, to educate them. Thankfully, when we went, they agreed that they would give us the audience. So they gave us the community center. The chiefs came, the elders came, all the people came, and even they invited people from other communities to come and listen to what cleft is. And we're able to educate them about cleft, that it is not a taboo, that the child who had cleft is like any normal child, and that killing the child was not the right way to deal with cleft. And it's helped to reduce the stigma. It helped to get rid of that taboo. And now we are getting children from the community and surrounding areas to our center who are not suffering that abuse that former children in that community have suffered because of the cleft. So these are some of the success stories that I can share in my work with children with clefts and their families. Thank you very much.
Wow, thank you so much, Seth. And we just have a few minutes left, or we're just wrapping up. So I see a few questions in the chat, and maybe we will just answer them on the LinkedIn post. I think this LinkedIn Live will be available on LinkedIn, and Seth, you and I can go in and take a look at the chat question or the questions that were asked and answer there.
Sure.
Great. Well, thank you so much, Seth, for being here. It is truly incredible to learn from you. Psychosocial care is such an essential pillar for spinal trained patients and families, and you are truly making a huge difference in the world. Thank you all for tuning in, and see you on the next LinkedIn Live. Thanks, Seth.
Thank you, Grace.